Hello everyone, it's me. I'm back again, nurse practitioner Dr. Katina. I am here to give you all some health tips. Now, I wrote down my tips because I don't want to forget them. I want to get them all. So this is Dr. Katina Health Sex Tips. Now, if you've been following me for years, you have heard some of these before. So this is like a compilation of everything that I've talked about. All right, let's get to it. Number one, make sure you are completely lubricated prior to penetration. That's right. You want to be lubricated. Do not allow your partner to use spit as lube. You heard that. That's right. And don't act like that's foreign to you. Sometimes when you've had sex, your partner may have put on his hand, spit on his hands, his fingers, and put it on his penis, right? That has happened. First of all, it does not lubricate long. It does not last long. And then by doing that, you're introducing sometimes some bacteria and yeast. So use, my favorite is coconut oil. Coconut oil does not work good with condoms. So you're going to have to use a lubricant that you're not sensitive to. All right. So next one is when you're getting ready to have sex, you want to insert the penis gently inside of the vagina. Sometimes when you insert the penis, and usually sometimes when the men insert, they just kind of jab it in, or they, oh, that's the wrong spot. Yeah, you've had that. But if he does not gently insert it inside of the vaginal opening, this can cause tearing of the perineum area. And the perineum area is that area between the vaginal opening and the anus. So that area right there, that part that sometimes, gets a little tender after sex, and then it can tear. So sometimes we may actually have to suture that area. I've had patients to come in and they've actually had a perineum tear because of sex. All right, next one. Uterine spasms. All right, so I don't know if you've ever had sex where, you're having sex and the next thing you know, you're having this intense pain at the bottom of your abdomen in your pelvic area. It's very painful. Sometimes it causes nausea and you have to stop. Well, this is called a uterine spasm. And this can occur sometimes when you're having rough sex, or if the penis is actually constantly hitting the cervix/uterus area. It's constantly hitting it. And it can send a spasm to the cervix/uterus area. Now, when that occurs, you got to, first of all, take a break. All right, take a break, and then drink some cold water, a cold compress, apply that to the bottom of your abdomen area. Sometimes you actually have to take like an Advil or leave to kind of relax that spasm. But most times just rest and cold compress to the bottom of the abdomen, and some cold water usually works. All right, let's move on. I don't want to make this long. These are just some health tips. All right. Oh, this is a big one. I've talked about this previous times before, and numerous times before. You can have a vaginal orgasm. Yes, you can. How do you do this? Partake in self-pleasuring with the dildo to explore your own G-spot. Your partner cannot make you have an orgasm if you haven't made yourself have an orgasm. And I'm talking about a vaginal orgasm. So once you found your spot, because you've explored your body, yes, don't be afraid to explore your body. When you're having sex, get on top and ride your partner and constantly manipulate that spot. You know where that spot is because remember, you've used it. You've touched it when you actually explored yourself. So get on top and ride the penis and just constantly manipulate that spot. And a lot of times you'll have a vaginal orgasm that way. You have to try it first yourself. Again, if you can't make yourself have a vaginal orgasm, then your partner may not be able to. You have to know your body. All right, next. This one's for the men. I had to throw you all in there a little bit. All right, if you ejaculate 5 minutes or less after sexual penetration, this is called premature ejaculation. So like as soon as you enter, and you explode. Yes. Okay. Yeah. not medical term, but you guys get it. You know me, I speak in lay terms. But as soon as you enter and you have an ejaculation, that's called premature ejaculation. And they do have medications for this. And sometimes that's caused by oversensitivity of your nerves. So anxiety can sometimes cause that. And so deep exploration may be considered. You need to get some blood work done, but there are some medications that can help with that. All right, ladies, men who have difficulty with flexibility, use your sex pillows. They help, I promise you. The sex pillows allow you to explore different positions sexually, and they can get deeper in the vagina during sex when you're using, different positions. So go ahead and find you a sex pillow. All right, also, next one. No excessive masturbation. That's right. You've heard me talk about it before. Masturbation is fine. It depends on your religion, what you want. But coming from a health perspective, it's okay as long as it's not excessive. And excessive means like when you're doing it at work, you have to go to the bathroom, take a break every hour just to go masturbate. It becomes an issue if it's excessive because it can actually interfere with you having an orgasm during your sexual intercourse. I've had some couples that they can't get pregnant because the guy, he masturbates with his hand so much that he can't ejaculate inside of the vagina. So the couples have problems getting pregnant that way because he's not ejaculating inside. The only way he can is with his hand. So it can interfere, ladies and gentlemen, if you participate in masturbation excessively. So watch that out. Also, I get lots of questions about libido. I don't have the drive. Well, number one, you want to make sure your blood work is okay. Different conditions, thyroid disorders, anemia, hormone imbalance can affect your libido. Medications can affect the libido. However, one thing that you can do, and you need to remember, the more you have sex, the more your libido will elevate. Yes, remember, if you don't use it, you lose it, right? You got to increase it. When you have sex, you're orgasming, that helps. You're going to want more and more. I promise you, try it. That'll raise that libido. Also, all right, come winding down here. Don't leave me quite yet. I got one more after this one. Now, I know you all, when you're doing your foreplay and you're using your fruit and your scented oils and your whipped cream and, he's putting all that down there on the vagina and he's going to have him a good time, right? If you're doing that during foreplay, beware. If you're using whipped cream, strawberries, scented oils, anything down there, our kitties are sensitive. That's right. I call it the kitty. Our kitties are sensitive. So beware when you do that because you may be at risk for a vaginal infection or a yeast infection because those things actually alter our pH. And we're sensitive. So any little thing can kind of alter it. And then we'll get an infection. And then sometimes it's hard to get rid of. If you didn't view my vaginal infection or bacterial infection video, go to my YouTube, check that out because I have a whole video on that one. So YouTube, Dr. Katina. All right, last but not least, be active during sex with your partner. Sex should be enjoyable. Communicate your sexual wants with your partner. You should never have a bad sexual encounter. That's right, you should never.